Hi everybody, and welcome to From This Corner TV. And I'm your host Marilyn Dayton, and I'm back with another great show for you. And I'd also like to thank the people that have been sending the positive comments about the show. They say that they get a lot of information, and they also say that it's just like you guys are just sitting and talking with some really good stuff. And that's what it's all about, okay? To educate, entertain, make it really interesting. And we've got another really interesting show tonight. We have with us Christina McKenna. Now, Christina, I'm going to have to read this because she's got a lot of stuff. She's actually someone I have started working with to help me with my nutrition, to get healthier, to lose a little weight, you know, just a little bit. And she's the most knowledgeable nutritionist I've ever talked to. So she's the one that I'm going to be working with and have started working with, and I'm really thrilled about it, and that's why I asked her to be on the show. She's a clinical nutritionist, and she's got all of these. She's got MS, HHC, and she also is a Reiki therapist. Now, while I talk about you, just sit and smile, look pretty. Christina began extensive training in nutrition, including training from the University of Bridgeport's Master of Science program, that's here in Connecticut, in human nutrition. She's board certified by the American Association of Drugless Practitioners, which I really like, as a holistic health practitioner. She's completed health counseling training from Institute for Integrative Nutrition and Columbia University. Ooh. Christina is also a trained USUI Reiki therapist. I'm going to Japan soon, so I'm going to practice that, okay. You've had the opportunity to work with a variety of physicians whose patients have cardiovascular disease, diabetes, Crohn's disease, gluten sensitivity, and those striving to lose weight. And you do usually lose weight when you have the right nutritional program and you feel better, right?
Exactly.
Okay, so that's what we're going to talk about. Her business is Healthy Dynamics, and she wants to help individuals and improve their well-being, yes, with nutritional education, a little bit of Reiki too, you know, if you need it. So today what we're going to be talking about is we are what we eat. We've all heard that. We're going to talk a little bit more about, you know, it's really kind of true. And what it means, what that means. And how important is attitude? Very important. Stick-to-itiveness is a good word. And movement. That's also a part of it. So let's start with this term that we hear, we are what we eat. What does that really mean?
Well, what it really comes down to is we are not like an equation, a math equation, like most people are accustomed to hearing about when you're talking about health and eating and what you should eat. You know, everybody's used to hearing about calories in versus calories out and how much you burn, you should lose weight. But the reality is what we eat goes into our body and gets processed and triggers all kinds of release of hormones and other kind of chemical reactions throughout our whole body that really can totally change not only how our body is shaped, but also how our body will process energy moving forward.
Mm-hmm. And so you're saying, tell us a little bit about this calories. Are we supposed to be counting calories, or is that really a smart thing to do?
Okay, so the good news is no.
Yay!
There's been a lot of research over the last 10 years, you know, that's the more recent research, where they've really been able to pinpoint exactly what's going on inside of our bodies. And I'll give you a quick example and then give you some explanation of it, but it's sort of like, makes good sense when you hear it like this. So we all could probably guess that 100 calories worth of broccoli compared to 100 calories of a piece of candy are probably going to do different things in your body, wouldn't you think?
Yeah, I
think
so.
Yep. So, yeah, Depending on what type of food it is will determine what's going to go on in your body. So if it's something that is very much filled with sugar and digests very quickly in our system, that then triggers the release of insulin from our pancreas, and the insulin is required to get that sugar into our cells, out of our bloodstream and into our cells. And it's important for that aspect of it, but insulin then courses through our whole body and does a bunch of other things that we really don't want it to do, including promoting inflammation, and can also cause, in the long term, a lot of other chronic diseases and even things like dementia. And as far as what most people are concerned about, as far as weight loss goes, insulin basically tells our body we've already got too much energy and it's time to store it all away for later. So it is a fat promoting hormone. Even if you've only had 50 calories and you're really hungry, if it was all from sugar, your body's not going to want to give up anything as far as weight loss goes.
Ooh.
That doesn't happen when you have broccoli. There's really no sugar in that. Broccoli is a carb, but it's loaded with fiber and it digests very slowly, and you really don't have a release of insulin from that. So you just digest the broccoli, you get the energy and the nutrients from it without all of those negative side effects.
So broccoli is a carb, but so there's kind of good carbs and bad carbs?
Absolutely.
Ah.
Good point. Thank you. Yes. So carbs are not evil, but you want to have carbs that what we like to call slow digesting carbs. And typically those are going to be carbs that are packaged in a way that there's a lot of fiber in there as well, which slows down the process of digestion. Some of that fiber is actually digestible, some of it is not even digestible at all. It gets used by the bacteria in our gut for lots of other things, or just kind of acts as a bulking agent to keep everything moving through our digestive tract.
So if you go on a, quote, diet, and they say stay away from carbs, they're not necessarily talking about broccoli, right? They're talking about other carbs,
yes.
like pasta and...
Yes, yeah, definitely. So there are all different kinds of diets out there, of course, and some of them work a little better than others. There's the typical low-carb diet that we probably all have heard about these days, Atkins, paleo, those sorts of diets. And Atkins in particular doesn't even hardly have any vegetables in it at first, in the early phases of that program. So depending on what diet you're talking about, you could be not even having that. But to be eating in a way that's very nutritious, but also is going to help to promote weight loss and cut down on inflammation, you definitely want to stay away from the carbs that digest quickly, like pasta and bread and candy. And unfortunately, a lot of processed foods are loaded with different types of sugars and carbs in it that will quickly go through your system, resulting in a lot of insulin release.
So insulin, let's talk a little bit about insulin. We're kind of jumping around a little bit here, but because I'm working with her, I got these questions too. So I hope you don't mind.
Not at all, not at all.
Now, I have been told that I'm insulin resistant.
Okay.
Now, what does that mean in my body?
Okay, that's a great question. So let me take a little bit of a step back here and explain what's going on. In our cells, particularly our muscle cells and our fat cells, that's usually where insulin is working. Mm-hmm. The insulin is used to open a doorway in your cell, basically, to allow sugar to come in. It can't get in otherwise, unless you're exercising. It's the only time it doesn't need any help. So somebody who is insulin resistant, you can kind of imagine it like that doorway is an old door and a hinge needs some grease and it opens up very difficultly.
We don't need to get personal here, honey. Old door. Old door, old person, okay.
Not what I meant, not what I meant.
I know.
But it takes more insulin to get that gateway open to allow the sugar in with someone that's insulin resistant compared to someone who isn't, where only one molecule of insulin will get that door open. Someone who's insulin resistant may they'll need a lot more of that to get it all the way open to work, to have the process work properly. And most people that have any kind of metabolic disease are insulin resistant. It is a hallmark for many of the chronic diseases that are out there, heart disease, diabetes, all of those. Most of the time, people are insulin resistant. If you're type 2 diabetic, more than likely you're insulin resistant as well.
So that's kind of a mark, a warning mark with me that I'm insulin resistant. And now I may have been insulin resistant most of my life. I have no idea, but I had a thermography test done by Dr. Jamie Lee. She's been on the show, and that's where it turned up.
Mm-hmm. Chances are you probably have been insulin resistant for many, 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 many years. It's oftentimes genetic. This is where it can be inherited. However, depending on what you eat, you can actually trigger the foods, and the nutrients in the food can trigger coding of different types of proteins in our body from our DNA. So you can make it worse or better based on what you're eating and how you're exercising. But it often stems from a genetic trait.
Okay.
Yes.
So I don't need to worry because I'm working with her now, so
Yes.
I'm not going to worry about a thing.
Yes, definitely. I'd like to just chime in for the audience, something that I really want everyone to know that's related to insulin resistance. And when you go to the doctor's office and you get your sugar tested to see if you're diabetic, a lot of times, particularly primary care doctors, will only test fasting blood sugar levels, which is only measuring how much sugar is in your blood. If you're insulin resistant, which is a precursor to diabetes and heart disease and everything else, your blood sugar levels will remain normal, but your insulin levels will be extremely high. And if you don't test for that actual level of insulin that's been circulating in your system, you'll never know that you're already on the road to all of these chronic diseases. So it's really important to ask them to have your insulin levels tested.
Okay, so rather than sugar levels, so to speak?
In addition to.
In addition to.
Yeah.
Okay.
Typically there's something called a C-peptide test that they can do, which will look up a piece of the insulin molecule that gets it activated in the system.
Okay, I'm writing that down, folks. So what does it mean, and then we'll move on to something else here.
Okay.
What does it mean if, like me, take me for example, I was hypoglycemic for the first half of my life, okay, pretty much. I would get these dizzy spells, my blood sugar would be very low, like around 35 to 40 generally, and sometimes lower. And now it's up to like 108 on the recent test. And it's like I'm going, oh, what's going on here?
Yep. Okay, so because you've been insulin resistant all these years, most likely, due to genetics, when you were younger and you were experiencing the low blood sugar levels, it was because your body tries to compensate for the insulin resistance by putting out lots more insulin. And it's very hard to regulate very evenly the amount of glucose or sugar going into your cells with this problem. So sometimes it will work properly, but other times the insulin will overwhelm the gateways and all of the sugar kind of pours in, and then you have a crash.
Yeah.
And because of the insulin resistance, your body's not able to properly really regulate the levels. And over years of our lives, eventually the pancreatic cells that make the insulin, they begin to kind of give up a little bit. And if you have type 2 diabetes, people that have type 2 diabetes also sometimes have a genetic problem with those pancreatic cells, in another genetic issue where eventually they don't work as well as they used to. So eventually you don't have enough insulin anymore to keep up, and so then your sugar levels start to rise.
Gotcha. Okay. All right, enough about me here. Let's
Oh, that's just not you in particular.
Yeah, but
that's
Yeah.
everyone with this issue, which is a lot of people.
And there seems to be an increase of different diseases than we've ever seen before. Everything from Alzheimer's to autism, and we've talked about that. We're going to be talking about Alzheimer's in another show or two. And diabetes, heart disease. We're eating more processed foods.
Absolutely.
Not good.
No, and a big problem with some of the processed foods, particularly, is high fructose corn syrup, because it doesn't digest in our system at all like any other food would. It really doesn't go anywhere except for to our liver, and causes a significant amount of inflammation throughout our body. And inflammation is at the core of pretty much all of those diseases you just mentioned. And high levels of insulin also promotes more inflammation as well. So I'm not going to say they're the cause of everything, but that type of processed food not only promotes inflammation, it can also turn on genes to, work against your body even further.
So what we want to do, and I know what I want to do, is I'm working with you so that we find the specific problems that I've got, whether it's gene-based or lifestyle-based, and I'm not a big processed food person. But still, there's not everybody is the same.
Nope, not at all.
But one thing that's the same is when we go grocery shopping and we're looking at the ingredients, you got to look at the ingredients, people. What are, like if something ends in OSE, we don't want it, right?
Absolutely. That's a good hallmark of something that is made up of sugar. Put it back.
Okay. Are there any other of those things that we should look for without?
Yeah, so definitely anything that has sugar in it, anything that ends in OSE, anything that is maltodextrin or agave or any of these other, even corn syrup or molasses, all of those are forms of sugar. So you want to stay away from those for sure. And off of the sugar topic, but equally as bad for us, is hydrogenated oils, trans fats. We really want to stay away from those as well. Our body, they're not naturally made our body doesn't know how to digest them properly, so it just goes and does tons of damage to us. And if you're looking on the label and you see the word hydrogenated, put it back. That's the process they put oils through to make them more stable, but that always results in a trans fat. So even if the label doesn't say trans fat, if you see hydrogenated, it's in there. Definitely stay away from that.
I hope you're taking notes, people. Got a lot of stuff coming your way here. And I'll tell you, when we meet, we have a group that meet with her, although we're all different. We're taking notes like crazy. She's handing out stuff to us, and we're taking notes, and we're supposed to be following her instructions. We try very, very hard.
Excellent students.
Yes, and we're going to be talking about attitude and movement a little bit later. But anyway, so we started on the low glycemic eating plan, right?
Yes.
Now, what is the advantage of this particular program?
Okay, so there are a lot of benefits to this, but the main focus is that you're having meals and food that is not going to result in big, quick bursts of sugar going into your bloodstream and into your system, which then in turn results in release of insulin and inflammation and everything else we just discussed. That allows your body to process the food, and the only way to have low glycemic food is to be having real food, basically. So you're eliminating all of the processed food when you say low glycemic meal. That instead you're having protein, you're having healthy fats, which we can talk about in a minute, and you're going to have healthy vegetables and even some healthy fruits. Make sure that you always have protein and fat with every meal, and sometimes some of these slow digesting healthy carbohydrates. So you're filling your body with food that's packed with nutrients that your body needs to operate properly, and you're not triggering the release of insulin, which promotes fat storage and all those other nasty things.
And the interesting thing is that each one of us in the group experienced a different reaction for the first week to 2 weeks. It's like a shock to our bodies, you know. I mean, we're eating really good stuff and paying attention, which is very important. Pay attention to what you eat.
Yes.
And is that because our body's adjusting, our body's going through a change?
Most of the time, it's kind of like an alcoholic going through withdrawal.
Ah, gotcha.
It's a sugar withdrawal, you know,
Okay.
typically. And it can be, your body can actually feel flu-like symptoms, and you could be tired and crabby, and typically can take up to about a week to really get through that not so pleasant phase. You can really crave sugar a lot more during that time frame. But once your body has a chance to readjust and reset that hormone balance, then typically people feel better, unless they have some other issues that need to be addressed.
Right, right. And we call that the 10-day reset plan.
Yes.
Right?
Yes, exactly.
And if we cheat, guess what? Like, I cheated a little bit, and it's kind of like, I told her, I think I should go back on the 10-day reset plan because I was a bad girl. Not a lot, but just enough. Bad. Okay.
No, it's not bad. That's just life sometimes. You know?
Exactly.
It all has to be in balance.
Now, one thing I've been unclear on is what exactly is gluten?
All right, that's a great question, and there's a lot of information floating about in the media about gluten. So basically, all gluten is it's kind of a common word that's used to describe various different proteins that are found in grains, particularly in wheat and barley and rye and a couple of others as well. And some people have a sensitivity to it. Also, it is used a lot, the gluten is removed from the grains, and it's used in a lot of processed foods because it kind of acts like a glue, and it helps things to stick together when you're trying to make food.
Okay.
The reason why there's so much fuss about it right now is because a lot of people they might actually have an allergy to it, or more likely they just have a sensitivity, which means it's not a true histamine reaction like an allergy would be, but when it's consumed it can not be digested easily and can cause some irritable bowel syndrome. It can even cause problems with eczema and rashes and things of that nature. But people that have celiac disease and oftentimes even Crohn's disease usually do have a very extreme reaction to gluten, and even a lot of children with Down syndrome as well.
So when you're working with patients and doctors, you're keeping all of this in mind as you review the case of that particular person.
Absolutely.
And trying to guide them into how to put the right things into their body to actually get better. Can you get better from some of these diseases with eating the right food? Can you actually get rid of most of the symptoms?
Yes, depending on what it is. Most of the chronic problems like diabetes and cardiovascular disease and irritable bowel syndrome, a lot of those types of diseases you will have great relief from those symptoms. I'm not going to say it's going to cure everything necessarily, but I've had a lot of experience with people where they were able to drastically cut down on the amount of medication they were taking, especially with diabetes and even with like blood pressure medications, just by changing what you eat.
I think that's fascinating. You know, there's not a lot in life today that we've got control over. And we've talked about that before. We've had cancer survivors on, and we talk about who is really in control of our bodies. Is it the insurance company? Is it the doctor? Is it the drugs? Et cetera, et cetera. And where do we come into it? Well, this is one way where we can work with someone like yourself who really knows what they're talking about. Big difference here. That's why I'm introducing her to you people. And have less medication, feel better. Oh, it's like it's almost like a miraculous kind of thing. But you have to listen to her and do what she says. Not always easy.
No, and you have to plan ahead because of the world that we live in is fast-paced, grab and go, stop at McDonald's or Dunkin' Donuts, or buy a frozen meal and heat it up at home. If you don't take the time to plan and go to the grocery store and have things prepared ahead of time, you won't succeed. Unfortunately, you have to put the effort into it.
And you know what? It's worth it in the long run, though.
Definitely.
Because, I mean, if
Absolutely.
it gets the kind of results you're talking about, you've got to do something like this, right? Now, what I do is once a week, and it's usually on Friday. I work generally 7 days a week, so it's kind of like, what am I going to do this? So what I do is I say, okay, it's Friday. Saturday morning, I'm going to go to the grocery store and get the things that I need. I'm going to whip up the food that I need, or at least have it there. There's like soups that you can make and you can freeze and have them during the week. Because you're right. I mean, we are all going frantic, just surviving and working nowadays. It's so much more stress, so much more busyness than ever before.
Absolutely. And I think, too, although it takes some effort to go and plan and make the time, in reality, for the whole rest of the week, that's a stress you don't have anymore. You know it's already done. You don't have to worry about it. And even if you were going to be eating junk food, it's still stressful trying to figure out what you're going to feed your family for dinner and everything else. So when that's totally off the table and it's already done, that frees you up to do other things that are important in life. And then by eating that food, it then gives you the amount of energy that you need to do it well.
And it also gives you clearer thinking.
Yep.
Which, very noticeable. Very noticeable. It's like, oh, wow. I sat down and I worked on a project and I got through it and I didn't go, and it's like, wow, I was so proud of myself. And it's true. It works really. I mean, it makes a huge difference. But anyway. So, before we get to the mental attitude, was there anything else that you wanted to touch upon?
I guess just a quick summary to give as a tip to everybody that's listening. Try to always have 3 meals a day, if you can. Don't skip breakfast. Always have protein and fat with every meal, even snacks, because that helps to keep the glycemic load of the meal low. And go with the slow carbs. And have some emergency food on hand, like even if it's just some walnuts or something like that, so that if you run over and you're hungry, you don't go to McDonald's. Instead, you can grab some walnuts and stay healthy.
And there's these little containers that don't cost an awful lot. You can get them at one of these, dollar stores almost. And you can, which is what I do. I've got a bunch of, different kinds of nuts in them, and I have them with me, which is why my purse is so heavy. And so we're going to take a break in a second, but I didn't want to interrupt you with the tips. And
no, that was it for
so
food.
when you say even your snacks, for instance, like I love almonds, and almond butter is so good.
So tasty.
That I will even take, even a piece of broccoli, that's, that you would be putting in your salad. I'll just, I've got a few, and I'll just go, with the almond butter on it. Really good. But
that's an excellent snack.
yes, I know. I got that from you. Thank you.
You're welcome.
Okay, so we're going to take a little break, and when we come back, we're going to talk about your mental attitude, and we're going to talk a little bit about movement too. Okay, so stay tuned. We'll be right back.
Bye.
Can you help me with this? My new dad teaches me all kinds of stuff.
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are. When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Up, college is hard. Down, those books are heavy.
My sport is football, but my passion is education. So every year I take promising high schoolers on a college tour to show them that higher education means a brighter future. My name is Nnamdi Asamoah. I don't just wear the shirt, I live it.
You can be a reader, tutor, or mentor too. Take the pledge at liveunited.org/volunteer.
Do you wear this?
Doing the laundry. Watch him doing the laundry. Okay. Reminds me, I got to do mine tomorrow. Okay. You're back with us at From This Corner TV, and I'm Marilyn Dayton, your host, and we've got Christina McKenna with us, who's a clinical nutritionist, and she's amazing. And we've been talking about you are what you eat. We didn't talk about glycemic index, so we might touch upon that for a little bit here.
Yes, thank you so much. So the term glycemic index basically is referring to how quickly a piece of food is going to impact your blood sugar levels. And it's measured against a set amount of carbohydrates, and then it's compared to table sugar or a piece of bread. So, for example, a 100 on the glycemic index is if you swallowed a spoonful of sugar. Okay, does that make sense so far?
A spoonful of sugar makes medicine go down. Yeah. Sorry.
Right.
Yeah, it makes sense, yes.
Okay, so that's the term that was originally used, and it's kind of morphed a little bit where now people are more often using the glycemic load, which takes it one step further. It's actually using regular portion sizes of food to measure the effects on blood sugar levels, and instead of 50 micrograms or milligrams of the carbohydrate. And the reason why they needed to do that is because 50 grams of carrots is a heck of a lot of carrots, way more than someone would ever eat in one sitting. So if you measured it under the glycemic index, that level would be quite high, but the reality is nobody ever eats that. So the glycemic load is using real portions, and also then will take into account your whole meal, because what you have together will impact how it all digests in your system. So if you have something with protein in it, it will digest much more slowly. If you have something with fat in it, it digests even more slowly. So the glycemic load of a whole meal will depend on what foods are in it and even how it's prepared.
And one of the things that you said was portions. And one of my challenges is I love food, especially the recipes that she gives me. And I would load my plate. I got a smaller plate. That was a good start. But I still kind of loaded it because it was just so good. But portions is pretty important too, isn't it?
Yes, portions are important, especially when it comes to the protein and the fat. But unlike in the past where you had to weigh everything and measure everything, you don't really need to do that. You really just need to take a look at your plate and try to fill 2/3 of it with veggies. And then have about, on average, a deck of cards is a typical size of a serving of a protein, a healthy protein. And then fat, usually it's around a tablespoon or so. That is a healthy serving size. So you don't want to go crazy with those two types of nutrients.
Okay. Now the fat, can it be what you cooked the food in? Does that count? Or
Yeah, definitely. So some on that subject, maybe we could talk quickly about healthy fats.
Yes, let's.
Okay, so olive oil, everybody knows olive oil is a healthy fat for you. That's a monounsaturated fat. You should get extra virgin olive oil. What not as commonly known is that you should not cook olive oil past a medium-high heat at all, because it will become oxidized and possibly even rancid and will turn into trans fats. Yes, so you want to stick with olive oil for salad dressings or very, very low heat settings. Coconut oil, on the other hand, is a completely saturated fat, which in our previous lives everyone thought was bad for you. But research has now shown that depending on what it is, that's not the case. And coconut oil is actually a superstar in the world of fat. And you can cook with it and it will not oxidize at all. You can cook on high heat, you can saute with it. And it has a whole host of other benefits, loads of minerals, and it actually doesn't even, because it's a medium chain fatty acid, it doesn't get stored as fat in our bodies as quickly as other fats do. So you could even have a little more of that and not worry about your portion control quite as much. And you can put it on your skin and your hair and whatnot.
Oh,
yes.
inside and outside too. How good
Exactly.
is that? You get a lot of it.
A lot of bang for your buck with the coconut oil. Some other sources of good fats are avocados, believe it or not.
I love those.
Yep, they're very good for you. And nuts in general, I would say stay away from peanuts, just because their ratio of omega-6 to omega-3 fats is not great. So they're not a super option. But any of the other nuts are an excellent source of fat, and nut butters as well. So those are all
Like
good
almond
options.
butter.
Yeah,
Yes,
fresh almond
really
butter
good.
is so good.
Now,
Yeah.
we're talking about portions of food and that kind of thing, but let's talk about organic for a minute.
Okay.
Okay.
Yes. Okay, so this is, in the perfect world, everything organic is the best. But in reality, that's not always possible, for a lot of reasons. You can't get it. It doesn't stay fresh long enough because it's traveling from elsewhere. It's too costly. A lot of that, it comes into play. So the most important foods to have organic are going to be your meats and some of your vegetables. So first I'll talk about the meat. You want to have any beef that you have, you absolutely want it to be organic, because they won't be able to pump it full of hormones and antibiotics and all of that, which stays as active drugs and that we then consume and have in our system. So you definitely want to stay away from that. But when it comes to the beef, you also want to go one step further and make sure that it is grass-fed beef. Organic is not the same as grass-fed. They're two separate things. Organic just means no hormones, no drugs. Grass-fed means it ate grass its whole life. And the reason for that is that cattle that were grass-fed will have the right ratio of fat, omega-6 to omega-3s, the healthy ratio for us, because they were grazing on grass.
Yeah.
If they're corn-fed, then the ratio is way too much omega-6, which then is very dangerous for our heart. It clogs the arteries, and what we typically think of as meat being bad for you, that's what happens from corn-fed beef.
Wow.
So even your eggs and your poultry, if you can get them organic, so you're not getting the hormones and all of that stuff, that's great. If you can get them grass-fed, even better, but it's not as critical as with the beef.
Gotcha.
And as far as fruits and vegetables go, a way to save a little bit of money is the ones that really you need to have organic are ones that are thin-skinned, both fruits and vegetables. So for example, tomatoes and grapes, they have a very, very thin skin, so the pesticide gets in and stays in there, and it kind of goes through the whole plant.
Yeah.
Opposed to a banana or an orange or a coconut, which has such a thick peel around it, most of the time that pesticide residue stays on the outside and you don't eat that portion of it anyway. So you don't really have to worry about organic as much with those.
Wow, I never knew that. That's
Yep.
cool.
You can Google, actually, the Dirty Dozen, and it will list the fruits and vegetables that are most loaded with pesticides, and then on the flip side, it's the Clean 15, which is the ones that you don't have to worry about buying organic.
I love it.
Environmental Working Group puts it out.
That's really cool. That's great.
Yep.
So, okay, so we're talking about what we put into our bodies. And now let's talk a little bit about attitude, because it can be a little tough to, a lot of people can't make changes in their lives very well, especially when it comes to their food.
Right.
So let's talk a little bit about mental attitude.
This is a much more challenging aspect of it all, I think. You know, people eat what they eat for so many different reasons. Most of the time, it's not even convenience. It's food is being used as a drug almost. You know, it can be used to make you feel better. It can be used to make you feel like you're not lonely. It can be used to celebrate. You know, it's so many different things, and it's entranced in our lives as we grow up. And it's no longer just like gasoline in your car. It's so much more than that. So, and I myself totally understand and battle with eating emotionally, and sometimes life is just tough. And
yeah, me too. I'm an emotional eater.
Yep. And the fact of the matter is, chocolate and even a lot of sugars will release endorphins in your brain, which make you feel good. This is why people do it, because you do actually feel better, briefly. You know, then for the next year, you've got all the consequences of that food. You know, just like every other drug. You know.
Yeah.
So this is something that, depending on what the person's specific issues are, it really makes good sense to try to keep a food journal and keep track of when you're trying to eat well, when things come up that make you want to make bad food choices or actually go ahead and make the bad food choices. If you can just write down how you're feeling at the time and keep track of that, over time you'll kind of get a sense of what is prompting you on an emotional level to do that. And once you figure that out, then you can take steps to heal yourself, you know, emotionally, whatever that takes. Sometimes it's getting bad people out of your life, or changing your job, or making more time for yourself. A lot of women probably need to say, no, I can't do that a little more often, spend a little more time on themselves. But everybody's different, and it's something that I feel is one of the most challenging things for people, especially people with diabetes, because they tend to have more cravings for sugar because of the status of their body. They crave more sugar, they get hungrier, they eat the foods they don't want to eat, then they feel bad about doing it, and they feel bad about themselves, and they go into this huge cycle which spirals out into their life. And so it can be really important.
Very important.
Yeah.
And the thing is, we should respect ourselves enough
Absolutely.
to take care of ourselves.
Yes.
And I know a journal, if somebody says keep a journal, they're not saying for them. Write it down for you.
Right.
Because I noticed in my journal when I cheated a little bit, I didn't cheat a lot, but I cheated a little bit, had some emotional things come up, and I had we were all eating the same thing. And I noticed a difference in the way I felt. And that's one of the important things. I was getting the external, not really the external pressure. I didn't have to eat anything if I didn't want to, but I felt socially I should join in, okay, that pressure. And I noticed that I had trouble sleeping that night. My stomach was like going, you know, making a lot of noise and struggling. And I felt kind of fuzzy-headed, you know, just not clear, not good.
That's such a good point, Marilyn, that I'm glad you brought up. That's something that I think can be really helpful, especially once they've been eating well for a while and you start to really feel good most of the time, and then you see what happens when you make a less than good choice, and you notice how crummy you feel. And the more times you do that, the less frequently you end up doing it, because eventually your mind will say, this isn't helping me anymore. I know I'm going to feel crummy after this, so I'm not going to even do it. So
And
really good point.
another word for journal is diary, okay?
Yeah, definitely.
Put your feelings in there, put the truth, and face the truth yourself, because
Yes.
otherwise, why even bother?
Yes, that
Right?
is so true. And even when it comes to food, I know a lot of times, I used to do it too, it doesn't count if you don't write it down. You ate it, and if you don't write it down, then you're not going to hold yourself accountable to it. It really helps to see what you really are eating and how much. And if you're working with somebody like me, it helps me also to see when we're together, maybe there's some slight changes that you could make that will make everything work a little more smoothly.
And there's also another aspect of this, which is movement. We've
Yes.
still got a few minutes to talk
Yep.
about that.
Okay, so that's just as important. Nobody wants to hear that you've got to exercise too, but we do.
Yes, we do.
We definitely do. I alluded to this earlier in our conversation as well. The only time our body can directly use sugar right out of our bloodstream is when we're exercising.
Exactly.
Yeah, and exercise will move your blood around. It improves your circulatory health. It clears your brain. It gives you more energy. It helps you to sleep better, and it is just in general, pretty much essential. If you exercise enough and the right way, your body will have lots of muscle instead of lots of fat, and that actually burns lots of calories all day long too. So your body is like becomes more like a kind of a car that's been well tuned and is working properly. And you get those turbo engines that really need to be pushed to stay clean. That's kind of how our body is.
Now things have changed a little bit. We used to think that I got to go out and run 2 miles or something like that.
Right.
What is the difference now that's been found and researched?
So this is the good news about exercise. More recent studies have found that high intensity interval training, HIIT workouts, if anybody's heard of that out there, it is much more effective at changing our body chemistry and our musculature and improving our ability to utilize nutrients and oxygen and burn more energy and keep our metabolism up all day long compared to the older model of, jogging for 45 minutes or something like that. Or even the theory, all your footsteps add up all day. You can count them, 5 steps here, 10 steps up the stairs, and at the end of the day, that's an hour of workout? No. Nope, not true, unfortunately. I'm not saying that you shouldn't do those things, because movement is, you're still moving and moving your blood around in your muscles, but to really effectively work out, you need to give it your all. And you do some targeted types of exercises where you're really pushing your muscles and your heart and your lungs as much as you possibly can, because that then triggers a whole cascade of chemical and hormonal changes in our body that basically helps us to be more prepared to do that next time. And that's really at the crux of why that is the most effective method of exercising.
So you're talking about, instead of long-term, going at it full blast, short-term, then a pause and rest, and then short-term pushing again.
Yes, so most high-intensity interval workouts involve maxing out as hard as you possibly can for a minute or so, and then resting for anywhere from 30 seconds to a minute, and then doing something similar to that. And you can kind of imagine it's like when we were cavemen and women, when you're being chased by the polar bear or chasing the bear for whatever. You're working really hard and then you're stopping and resting, and that's basically it. Doesn't take that long either. The studies have found that only about 15 minutes of that every other day, 3 or 4 times a week, is usually effective enough to really make some significant improvements in our health. Now, you have to do the right exercises, but it doesn't need to be hours of drudgery on the treadmill.
So those of us who are busy lives, like we've been talking about, we don't have to say, oh my God, a half an hour a day, every day, blah, blah, blah. It's not that, and you're talking about a day of rest in between.
Yes, yeah, so it's equally important to have the rest time. Our bodies have to have time to rebuild and repair and come back stronger. And if we don't give ourselves that rest, then we are going backwards in our improving our body rather than forward. So it's not just we can, it's we have to rest, which is a nice treat.
Now, I think the people that have been watching are going, boy, she really sounds like she knows her stuff, and it's true. And they're thinking, okay, I want to find out more about this young lady, and I want to talk to her. And you can. She's got a website, and Frank's going to bring it up. It's Healthy Dynamics CT for Connecticut.com, and she's also on Facebook. Now, on Facebook, do you have a chance to like post recipes and that kind of thing every once in a while?
Yes, I do. I do try to post some healthy recipes, even some tasty, healthy desserts here and there, or different tips on how to prepare for the week if you're a busy person, stuff like that.
And her website's got a lot of information on it. But the best thing to do is contact her, okay, and talk to her.
I would love that.
And she will help you take the control back over your life. She's helping me. And it's good. It's a good thing to do. I feel good about it. I'm looking forward to it. For those of you that don't know, and I am proud of it, I'm turning 70 years old this year.
Wow,
And
you look so fabulous, Marilyn.
Thank you. It's been a long, hard road. Okay, a lot of work. I've been working since I was 12, and I want to be around for another couple of decades or more, but I don't just want to be around, I want to be around in good enough shape so I can still keep doing my show, I can play games with my grandkids, you know, that kind of thing. That's what prompted me to, you know, that wake-up call. And it was on my bucket list too, but it was down there a little bit because it's hard work. And so I've made the move, and we're working on me. You're working on you.
I'm working on me too.
Which is
most definitely.
And we've got kind of a group going, which means that we're supporting one another. It's a small group, but it's a good group. It's a good group. And but you can work with her one-on-one. We're almost working one-on-one because of I'm different. What can I say?
Different and fabulous, though.
Different and fabulous, yes. So I want to say thank you.
Oh.
And it's just been wonderful to have you. And I knew it would be. I knew it would be.
Oh.
The more I get to know you and learn from you, I just knew that there are people out there that need to know about you.
Oh.
So thank you for being on this show.
Oh my gosh, Marilyn, thank you so much for giving me the opportunity to be on your show. I'm really honored and so excited.
Me too. And I'm excited that she's helping me take control of my life.
Well, you're already doing so well.
And I know you've got your pen and pad out. You've been taking notes. So here's some more notes to take. I always like to, in the last few minutes, I like to make announcements of upcoming events in the community. So I've got a few, and Frank's going to be bringing up the websites. The first one is Fairview, the annual Fairview raffle. It's time again. The folks at Oddfellows Home, and the first prize is $14,000, okay?
Wow.
So go to their website. It's going to be taking place October 2nd, so do it now. Well, after the show. Go to their website. There's a form there. Next, we've got Terry Broder Breast Cancer Foundation. They walk across southeastern Connecticut. They were with us on the last show. And just a reminder, you can still go to their website, which is tbbcf.org, and you can sign up to walk, be a volunteer, donate. That walk is taking place Saturday, October the 4th.
Can people bring their pets to that walk?
Why not? Just bring your poopy bags. And the next event is thecomo.org. You can go to their website. They've got a gala event to benefit the Stonington Community Center, which is the Como, on October the 4th at 6:30. Now, what you want to do is you want to sign up and walk or volunteer at the Terry Broder Breast Cancer Foundation, and then go home, clean up, and then you go to this event. It works out really, really well. And the Mystic Aquarium is where it's going to be, and it's going to honor our friend Suzette Tibbus, who's wonderful, and the Battle of Stonington Bicentennial committee, okay? So go to that website and thecomo.org. Then we have the Community Coalition for Children. Now they are coming on our show very soon, and they're going to be talking about the event on October 20th at the Gard Arts Center. And they're also going to have a workshop the following day. Their focus is helping children thrive. So go to their website and check it out. Then we have, I talked about this last time, sophiasees.org. There's going to be a dinner in the dark on November 15th to benefit Sophia Sees Hope, looking for a cure for blindness.
Oh, wow.
And then we have the Summer in the City, Groton. We had them on the show, and they were talking about there's a lot of art exhibit dates and locations, and it's also the 60th anniversary of the USS Nautilus. Can you imagine 60 years? It's amazing. So there's a lot of stuff going on in the city of Groton. Go check it out on their website, okay? And so that's pretty much it. But if you've got ideas or comments, send them to me at the Gmail email account here. And if you want to see our other shows, you can go to our website, which is also listed here, and they're all listed right there. Left-hand column, look for the latest shows, and then there's a PDF that you can bring up and look. Just click on them and look at them. And of course, I always point to each show on our Facebook page, just to let people know. And it's been great. And thank you for joining us so much. And thank you again. This has been a great show.
Thank you so much.
And I'm so excited. So join us next time on From This Corner TV. I'm Marilyn Dayton saying bye for now. Thanks for being with us. We're done.